Your heart might beat fast when you meet someone you really like, or push yourself during a workout. But if you notice any weird, abnormal heart symptoms popping up, it could be warning signs of a stroke. A stroke happens when the blood flow to the brain is stopped and the brain cells start dying. Strokes can happen to people of any age. High cholesterol, high blood pressure, and smoking are big risk factors. The National Institute of Neurological Disorders and Stroke emphasizes that time is of the essence when someone is having a stroke. Treatment within the hour can prevent long-term disability or death. There are warning signs for a stroke way ahead of when it will happen. Some of these signs can happen hours, days, and sometimes weeks in advance. Here are 7 early warning signs. 1. Face drooping. Does one side of the face look lopsided or droopy? The American Stroke Association suggests asking the affected person to smile so you can see their smile, so that you can eventually see if their smile is uneven or lopsided. 2. Arm weakness. People who are suffering from stroke can usually have unexpected weakness or numbness in their body, and it is commonly concentrated on just one side. WebMD have recommended asking the affected person to raise their arms above their head. Can they do it? Is one arm significantly lower than the other? 3. Speech difficulty. People who are affected by a stroke can usually have trouble speaking clearly, and they have the tendency to slur their own words. Ask the affected person to repeat what they are saying, and you have to make sure whether they are slurring or not. 4. Severe headache. An unexpected and severe headache can indicate as a symptom of stroke, particularly when it is combined with other symptoms. You have to note that a couple of these symptoms can happen in the case of migraine too, so it could be worth asking the affected person if the headache is out of the ordinary for them. If you are in doubt, ask or call for medical help. 5. Confusion. The Stroke Association has listed unexpected confusion as one of the symptoms of stroke. This can actually mean that an uncharacteristic inability to understand other people or even to articulate thoughts. 6. Changes in vision. Unexpected double vision or blindness in one eye can be a symptom of an approaching stroke. 7. Balance issues. Someone who is suffering from a stroke may experience unexpected problems with balance as well as coordination. If you are not sure, you could ask them to touch their finger to their nose or even walk in a straight line. Time is extremely important when you or someone else has been showing the early symptoms of a stroke. And if you would not remember all of these signs, then memorize the simple mnemonic from the American Stroke Association. FAST. Face drooping, arm weakness, speech difficulty, time to call an ambulance.